Hi, I'm Dr. Nixon. Welcome to Healing Peak Regenerative Medicine's Longevity channel. And today I just kind of wanted to do a history of prolotherapy and platelet-rich plasma injections and how do you choose the right practitioner for these injections, and how do you know you're getting good information and that the type of treatment you're getting is a good one, and that it's going to be effective for you, and that it's done ethically, because I think, similar to the video I did last week about supplements, there's not a lot of regulation on these injections yet, and there really isn't a standardized way of being taught how to do these types of injections. And the person that taught me is extraordinarily ethical, has a lot of integrity, and really teaches how to take pride in what you're doing and how to treat the whole joint, be a great diagnostician, and make sure that the injections you're doing are helpful for the patient and that the patient will get the best results possible based on overall health and also how the injections, the skill of the injection therapist goes. So what I hear a lot in my area is that platelet-rich plasma injections are excruciating, which is entirely unnecessary. They don't have to be painful in that way. They obviously are injections, so there is some pain associated with getting them done, but they shouldn't be excruciating. You shouldn't necessarily need someone else to drive you home, although it's a good idea just, to be cautious, but it's really not absolutely necessary for most of the injections that are done. And also I'm hearing a lot that mainstream medicine is injecting cortisone prior to injecting platelet-rich plasma injections, which render the platelet-rich plasma injection completely invalid. I mean, it won't work. And so then these really amazing, beautiful, elegant therapies that can get people a lot better without surgery are starting to get this kind of bad rap that they're ineffective or they're really painful. And neither of those things are true. If they're done correctly with the right technique in the right order, leaving cortisone out of the equation, they can be extraordinarily effective. And really save people a lot of pain and suffering, and also keep people out of surgery, which is a really big deal. And the reason I wanted to bring it up now, is because there's been some, articles in the newspaper in the Seattle area. Bobby Wagner just got it done. Seahawks players are getting it done. A lot of people are starting to find out about it, and there's not a lot of information out there. And I recently had a patient come in for just a plain old prolotherapy, knee injection, and she was terrified because she'd watched these videos online, and I think they scared her because I think the patients looked scared, or she saw that it was really painful or something, and it just isn't that. It isn't that way. So if it's done correctly. And so I just kind of wanted to bring it up and, educate people about it. So a lot of practitioners out there are using, when they're marketing prolotherapy, they're actually using proloneurotherapy, which is not the same as regenerative medicine prolotherapy. That therapy actually goes into a joint space and has a regenerative medicine quality to it. It's initiating cellular growth at a deeper level than proloneuro. And proloneuro is really a great therapy. It's just not a regenerative medicine therapy. It's used for different types of things. I do that too, but it's not indicated for, a meniscal tear or, knee strain or something like that. It's indicated for like peripheral neuropathy and some other types of more superficial types of pain, or musculoskeletal types of pain, pain at a less deep level, so to speak. Just to make that general, because it's not really what I want to talk about today. So prolotherapy, or the type of prolotherapy that I practice and the way that I was taught, was to look at the entire joint that I'm treating and, really know what the pain generators are. And you get to have more than one. And so I'm not just going to go inside your joint, inject a bunch of juice in there, and get out of there and not treat the rest of the joint. I mean, it's a pulley system, pulley and rope system. Every joint is a system and works within itself. And so if one thing starts to not slide correctly or creates friction or there's tension, then that's going to create another downstream reaction in that joint that's going to cause some issues to occur, and you have to treat all of it in order to get a really good result. And you also have to use the correct concentration of dextrose in order to get a good result. And you also really need to have good needling skills and technique. And so all of these things combined is what really creates a beautiful injection. And for a knee or an elbow or a hip or whatever it is we're treating. And that type of injection stimulates cellular growth at a very deep level and will treat, golfer's elbow, tennis elbow, any kind of tendinitis, tendinosis, plantar fasciitis. It will treat a lot of the itises. And what you're then seeing on top of prolotherapy, or a lot of people haven't even heard of prolotherapy, but it's really the initial step into regenerative medicine or regenerative injection therapy, and really should be done before platelet-rich plasma therapy or stem cell therapy is done. Stem cell therapy should not be called that. I have done a video about that. It's actually called biologics now. Stem cells are pretty bogus. And there's a video back a few weeks called, Magic or Myth Stem Cell Therapy, and I would encourage you to watch that video if you're curious about stem cell therapy. Platelet-rich plasma is very effective, and often stem cells or biologics are not needed if prolotherapy or PRP or prolotherapy are done correctly. And so, anyway, Bobby Wagner just had PRP done, and that's platelet-rich plasma, and that is very effective for joints that have had cartilage that has been degenerating, where you have bone-on-bone knee, or you've been told you need a knee replacement, or you've been told in a few years you need a knee replacement. Those are really great candidates for PRP if they're healthy otherwise. And the other thing that PRP does is beauty treatments. So, getting your hair to grow back. It's gotten some really good media for that, as well as aesthetics, wrinkle treatments and getting your skin to glow again, because it initiates collagen production. So anywhere that you grow collagen, it's a great, beautiful treatment to get. The most important thing for you to know is how your practitioner was trained and how many injections are they going to do. If they're just going to go into the joint space and inject that one area, they're likely not going to get the full improvement of what they could if they were to inject the whole joint itself as a system. For example, rotator cuff issue or rotator cuff tear, if they just go interarticular, meaning they're just going to go in the joint, they're going to get, some regenerative quality deep down inside that joint, which is important, but then they're going to miss all the attachments of the rotator cuff muscles onto the humerus, which is your arm bone, right? And they're going to miss some of those pain generators, and you're going to get some improvement, but not all. The other thing that's happening that I've heard is that cortisone is now being injected before PRP, which is a terrible idea. I mean, PRP initiates the immune system to regenerate stem cells or cartilage cells at a very deep level, and cortisone shuts that off. So if you inject cortisone into a joint, you have shut down everything that PRP activates. And so then if you go in there with PRP too soon, even 8 weeks later sometimes is not enough, then you're initiating that to turn all of that back on. Cortisone's powerful. And so PRP is really relying on your body's immune system, and prolotherapy is relying on your body's immune system to function correctly. And so if you shut it down with cortisone, the PRP, it's probably not going to work, and then it's going to get a bad rap. It's also going to hurt. And so it's really important that people start to know, and that there's some education out there and some material out there on how to pick your practitioner and make sure that they have been taught correctly how to do these techniques, that they're looking at you as a whole person, that they're looking at your joints as whole joints and not just one injection into the joint space itself. That's a fairly typical way for a medical doctor to do it, because that's how they've been taught to do cortisone, is just one injection right into the joint. And they're really missing, again, that holistic view that's often missing in Western medicine to begin with. If you're pre-diabetic or diabetic, if you're a smoker, if you have a lot of chronic long-term issues, if you have an autoimmune condition, all of these things need to be treated prior to getting these regenerative injection therapies, because if they are not treated, then your way of getting a good result from these injections is much less. And so whenever I do an injection on a patient, I screen them and make sure that, is their thyroid functioning? Are they diabetic? Do they have elevated inflammatory markers? Because I want them to get the best result that they possibly can, and I want these injections to be therapeutic and beneficial for them. And so if you're going to a mainstream MD or orthopedic surgeon or somebody who's doing or saying that they're doing regenerative medicine therapy, and they're not screening you, or they're not asking questions about, like, are you a fast healer? Do you have diabetes? Have you ever been diagnosed with an autoimmune condition? If those are not questions that are being asked to you prior to these injections, then they're not doing screening, and they're kind of missing the point on how these things work on a physiologic level. And so, especially if you're paying a lot of money, this is the same for biologics too, or stem cells as mainstream medicine calls them. If they're not screening you, and then you go spend $15,000 on a stem cell treatment, and then the stem cells could or could not be viable or even in there. And so you really gamble. You're really making a huge gamble with a lot of money. And so prolotherapy is something you can do that's very cost effective and a great way to start. And as long as you're doing it with a practitioner that's been taught well, then you have a really good chance of getting an amazing result. And so I was taught by Dr. Tina Moore. She is down in Portland, Oregon, and now I help her teach other doctors in this area, in between Oregon and Washington, and some come from all over the country actually, on how to do these injections correctly. I also have a master's in acupuncture, and so not only do I have thousands of hours of sticking needles into many people at many different angles for many different reasons, but the foundational master's degree that you have to get essentially, teaches you how to stick needles in people to get a desired result at a depth, angle, or level all over the body. And there really aren't many injection therapists out there that I know of that have both a master's degree in acupuncture as well as have been trained prolotherapists. And if people have not been trained as prolotherapists, then they probably shouldn't be doing platelet-rich plasma, because it's really about technique. And prolotherapy is where you learn that technique. And then PRP is just a different thing in the syringe. So prolotherapy and PRP are the exact same thing other than what is in the syringe, but they should be by technique practiced the same way. And so if your practitioner has not been practicing prolotherapy or doesn't know what it is and they're practicing PRP, that should raise a red flag. So those are some of the things that I just kind of wanted to address because they've come up recently, especially with Bobby Wagner having gotten PRP. I'm getting a lot more questions, especially around this area. What is it? Why do we use it? How should it be done? And so I hope that this answers many of those questions. And if you have any more questions, I would love to answer them for you. I'd love to have a conversation. It's a huge passion of mine. I've seen incredible things happen with these therapies. And many of my patients avoid surgery. Any of the ones that have been told to get surgery avoid surgery once they've had prolotherapy and PRP correctly done. And it's really amazing to be a part of that experience for them and to give them their lives back. And so if you have any questions or comments or a specific condition you want me to talk about, the golfer's elbow is a pretty popular one, plantar fasciitis, any of those things, joint replacements, please ask me a question in the comment box below this video. And if you are interested in these things, please subscribe to my channel and we will be around next week. Thanks so much. Have a great day.